Technological Tools in Long-Term Care by Demetra Bryant. Elderly health care carries a significant healthcare burden. Addressing the healthcare needs of the cohort necessitates technological solutions. Technological solutions improve the quality of care to elderly patients by complementing the care provision spectrum. This presentation looks into technological tools applicable in long-term care. The aim will be to establish practical solutions for implementation in the sector. An increase of the proportion of citizens aged 65 and above within the U.S. population has increased the demand for long-term care services. The aforementioned population segment has a higher health burden arising from chronic illnesses. In addition, life expectancy has increased, hence leading to increased demand for long-term care technologies. However, lack of information on long-term care technologies, inaccessibility, and divergent needs are significant barriers to technology usage in long-term care. In terms of age, technology for long-term care targets patients who are aged 65 years or higher. Preferences within the long-term care technology sphere influence client characteristics. 87.2% of elderly care patients have a high preference for home-based care, while 67.7% of residents have low preference for care in relatives' homes. In addition, 94.5% of elderly care patients have low preference for care in another country. Another feature is that elderly care technologies must address the physical limitations of the elderly. Therefore, mobility improvement to the desired level is integral. Psychosocial factors arise from loneliness, financial constraints, and anxiety among old patients. Even though improvement in physical health is necessary, addressing psychosocial needs is integral in long-term care. Patients may use reminders to schedule therapist visits and thereby reduce anxiety. Patient-centered technologies reduce financial anxiety since patients obtain high-quality care at a low cost. Technology components also address physical activity schedules, drug schedules, and checkup appointments, hence reducing patient anxiety arising from keeping the schedules. The Institute of Medicine framework for healthcare quality is the applicable framework. The first factor is safety for protection of aged patients from consequences of medical errors, whereby the protection improves health outcomes for the patient group. The second point within the IOM framework addresses effectiveness, timeliness, and efficiency. Effectiveness is through meeting patient needs. Timeliness is through alleviation of patient unease in early phase of care, while efficiency ensures value for money for caregivers and patients. The final point captures patient-centeredness and equity. Patient-centeredness focuses on meeting patient needs, while equity eliminates barriers in patient care. Financial considerations are on nursing costs since the costs have been increasing in the past decade. Cost effectiveness will be a fundamental value proposition for technological tools to reduce the financial burden. Legal factors on patients and copyrights are integral to avoid fines with withdrawal of licensure. The applicable public policy is the anti-kickback policy. Cash and non-cash kickbacks amount to corruption. Avoidance of corrupt practices in providing patient technologies within long-term care is crucial. Administrators and organizations that provide technologies for long-term patient care among old patients must ensure that organizational activities operate in sync. Seamless operations ensure that the entities attain the set vision. Further, administrators must maintain effective communication with stakeholders for teamwork purposes. Qualifications involve educational qualifications only since additional state licensure is unnecessary. The position requires managerial rather than technical skills since administrators oversee other departments. Ethical standards include confidentiality, informed consent, and non-discrimination. Core values include excellence for attainment of high care standards and community for meeting communal needs. Providing technological tools for long-term care of old patients involve multiple facets. Historically, provision of technological tools for the cohort has faced hurdles due to lack of adequate information, inaccessibility, and unacceptability. When designing technological care solutions, disparities in income and educational qualifications are critical factors. Further, a balance between ethical and business considerations is integral to ensure comprehensive and sustainable solutions. Here's a list of my references. This is the end of my presentation. Thank you guys so much.